Welcome to the 9th Annual MINK Conference. It's my privilege to introduce Captain Shary Jones. She is the Acting Regional Health Administrator for the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Health in Region 7. Captain Jones is a U.S. Public Health Service Commission Corps officer. She served as a public health advisor in the National Vaccine Program Office before joining Region 7 in 2014. Please welcome Captain Shary Jones.
Hi, good morning, everybody. Good morning. Is it cool enough for you? It was funny. I was on the way here, and I talked to my mom every morning on my ride to work, and she said, "Oh, she lives in D.C., Maryland area," and she says, "Oh, the rain is coming, blah blah blah." I said, "Well, the sun is nice and shine." I said, "Oh, but it's 37 degrees." I said, "I didn't bring a coat." She like, "You don't have a coat?" I said, "Not my uniform coat. I have plenty of coats in my trunk." But thank you for that introduction. I really appreciate it. Again, my name is Shary Jones, and I'm the Acting Regional Health Administrator here in Region 7. And you know, there are 10 regional offices across the nation, and the regional health administrators are really responsible for 3 overarching and essential functions, and basically putting prevention into practice, providing regional support to the other operating divisions and staff divisions, and overall coordination and collaboration of agency-wide resources. And so within the Office of the Assistant Secretary for Health, our mission is to optimize the nation's health investment, and also to advance public health equity and improve health for all people. And so just in case you didn't know, whenever I have to stand in front of a mic, the team tells me what to say, when to say it, and how to say it. And so I want to thank Christella Johnson here today. And so she was able to put something together, and by no means will it take 15 minutes. Because if anyone knows me, that I can't talk for 15 minutes anyway. But I was pretty excited to see the agenda and the theme, creating the healthiest region through partnership and science. The U.S. Surgeon General Vice Admiral Jerome Adams recently spoke about changing the map as it relates to health of our nation, and we all know that requires partnership in the application of science. It's always been my vision here within Region 7 to be the healthiest region. Right now, Region 1 will be the healthiest region, and it's a little inside joke that we have is that, you know, we're competing with them, but they don't know it's a competition yet. And so we would love the opportunity to become the healthiest region, have that designation, and have what we were able to accomplish be extrapolated to across the nations for other regions to duplicate. I believe many of the initiatives and the work that we do in our office could utilize partners and dedicated to public health. For example, you all heard about the recent initiative to ending the HIV epidemic, especially with changing the map, and also ending the epidemic within a generation. So to date, we have some of the most powerful HIV prevention treatment tools in history. Data on the burden of the current epidemic were analyzed to identify the counties with the highest number of new HIV diagnoses, the states with the heaviest rural HIV burden, and the territorial area now hardest hit. And these areas accounted for more than 50% of new HIV diagnoses in recent years, and Missouri was named one of those states. We're focused on preventing new infections and preventing the spread of infection by promoting scientific advances such as PrEP and viral suppression, as well as working with partners to create and enhance syringe services programs that would address the HIV and the opioid epidemic. And so I can go on and on about other initiatives in the office, but I understand I stand in the way of hearing Dr. Arsher and unleashing the public health power, as well as Casey and their wonderful initiative with Missouri, Healthier Missouri, and how we're going to transform public health in Missouri, as well as Sarah and childhood obesity. And that also gives us an opportunity, another opportunity, I should say, to partner, because we recently have the HHS guidelines that were recently released on physical activity. So just looking at creating the healthiest region through partnership and science, I believe it's a realistic goal, and I hope today we come up with some tangible methods to take away to see it coming through to fruition. And again, thank you for the opportunity and welcome. Pretty excited about what we have today.